There are 7 stages of pushing or pulling a wheelie bin, so let's look at them on a step-by-step basis. As with lifting, the first thing to do is assess. An assessment is where you're looking at the task that you have to do. So are you going to encounter a curb or a change in the ground level? Then you look at the individual who's performing the pushing or pulling, and the load that you're pushing or pulling, and the environment where you're carrying out the pushing and pulling of the wheelie bin. With pushing and pulling, you also need to make sure that the wheelie bin is in good working order before you start. Once you've checked the load is okay to push or pull, you can look at the position of your feet. We want the feet in a split stance with your lead foot used to tilt the bin and your weight on the back foot. In this tutorial, we're going to look at how to lift a load using a semi-squat lift. There are 7 stages of lifting, so let's look at them on a step-by-step basis. The first thing to do is assess. An assessment is where you're looking at the task that you have to do, the load that has to be lifted, and the environment where you're carrying out the task. Once we know our route is clear, we're going to look at our foot position. We want our feet either side of the load, slightly staggered and at roughly shoulder width apart. If you can, try and keep your feet flat on the floor throughout the lift. The knees should be bent, but not more than 90 degrees. This keeps the hips higher than the knees, which helps to protect them. Then keep the knees pointed over the feet so that they are in the same line. Your back position is the most important thing to stop you from getting injuries. It needs to be in a neutral position, which is without it bending forwards. And the neck and head need to be in the same line as your back. Use any purpose-built handles to get a firm grip on the load. Keep the load as close to your body as possible.
Now we're going to have a look at how the discs in the spine get damaged. Now most people know this as a slipped disc. Well, one of the discs is never just going to slip out. The spine is far too strong for that to happen. I'm just going to show you what does happen. The disc looks like this. So this is a view from above. In the middle of the disc, we have a part called the nucleus pulposus. But around the disc we have fibres called the annulus, which are made up of cartilage, really strong fibrous cartilage. Most of the patients that I see tend to have low back pain. So I'm just going to show you the main reason why that happens. Now mechanically we have quite a rigid base of the spine. Now here's your pelvis and we have the sacrum which slots in between. Now that's a very rigid joint, not a lot of movement through here. But what sits on top of that is a disc which allows movement in every vector, forwards, backwards, sideways and rotation. Let me just put that into context by looking at the middle of the spine. If I move the middle of the spine, you can see how each individual vertebrae and each individual disc will share some of that movement. However, if I now show you that same movement at the lower part of the spine, you can see where the movement stops on that rigid base. There's nowhere for that movement to be shared to. Another factor is we have 2/3 of our body weight on this lower part of the spine.